Yeah, so it's a really, really important question. And, we're really in the early days of using AI to identify suicide risk. I think there was kind of a very telling study that was published last year, maybe, or 2 years ago. Um, and what it was doing, it was looking at um, people who had died, but the intent around their death was unknown. So it was not clear whether or not this person had intentionally ended their life. Um, and what they found was that all of the data for the white decedents pointed to different stories than the black decedents. And this was in the United States. And what it suggested was that the things that have traditionally been used to categorize somebody as um, they likely intended to kill themselves, sort of history of mental health services, mental illness, et cetera, that those were not the things that were present for the black decedents who had much more data around physical health issues, high blood pressure, unemployment, some of these structural based issues. And when they did their analysis, they were able to identify or use this algorithm to identify 50% of the black decedents as actually having died by suicide that were traditionally missed because of not traditionally that were missed because of the ways that these traditional risk factors and indicators and markers that had been established by looking at primarily deaths of white people, because in the United States, more white people than any other ethno-racial group die, missed what was going on with the black decedents. So I think that it's a huge issue, and I think that as we move forward with this, being explicit in the beginning of the programming of the algorithms to understand variations in ethno-racial risk factors is going to be essential. Well, I mean, I think that the important point that you're bringing up is, we're inherently social, and I understand who I am because of how others around me respond, right? As an adult, right, I'm 52. I've had many years of people responding to me. So I have a pretty good idea of when I'm sounding pompous, when I'm sounding self-important, when I'm sounding ridiculous. Because of the feedback that I've gotten. If I am saying something and I think that it should be taken one way, but the computer is telling me something totally different, that could be dysregulating. I might be like, wait, am I missing something here? Like, I'm pretty sure that this, and this. Why does it think that? What is going on? And that, I think, could be really confusing. This, of course, is where it's really important at this point that we not have direct to consumer chat GPT, sort of as a substitute for mental health care. I really think it has to be in conjunction because of that exact issue, because it could sort of come back with a misinterpretation that, if taken seriously, wouldn't necessarily make somebody suicidal, but could cause them distress in ways that is completely unnecessary.